Now, underwriting. Health insurance underwriting. It's the ability of that insurance corporation to assess an individual's age, gender, their height, weight, past medical history, in order to determine whether or not they choose to issue this individual health insurance policy or not, and if they do, just how high they might jab that premium. And the process by which they do so is held secret in most instances. But luckily in some states, it's mandated that these conditions be filed, published with the insurance department. And that's the case in California. So let's look at some of these conditions in California. Some conditions are very vague, like health problems for which you have not seen a doctor. Automatic decline. You're not going to get a health insurance policy. Health problems that a doctor cannot fully explain. Automatic denial. Now, it's these very vague terms like this that are going to be important for an insurance company to have so that they can go back in somebody's past medical record, find a discrepancy in order to drop their policy if they choose to. It's conditions like that that are abused frequently. I saw an instance in the news recently where a lady testified before a House subcommittee that her policy was rescinded when she was diagnosed with breast cancer. Paid a lot of money to that health insurance company until she was diagnosed with breast cancer. It's an aggressive form of breast cancer, a terrifying diagnosis, also a very expensive one. So her health policy was dropped. Why? Acne. They found something in their medical record that said that she had acne, and by mistake the doctor had said that it was a precancerous condition. Now that's silly. Everybody knows what acne is. It's pimples. They're not precancerous. The only reason they did that was because they didn't want to pay out for that individual. That's fraudulent. Other conditions that are more concrete: AIDS, pregnancy of your spouse, adoption in process, automatic denial. All of these are automatic denials. Cancer, sleep apnea, major depression, heart disease, renal failure, diabetes, cirrhosis, multiple sclerosis, muscular dystrophy, lupus, history of transplant, current infertility treatment, rheumatoid arthritis. These are automatic denials. Others are more variable. Allergies while testing is in progress. It's either automatic decline or high premium. Ear infections controlled with medication, high premium. Ear infection, Lyme disease without symptoms after 1 year, automatic decline or high premium. Lyme disease can be treated and it's just gone. Ringworm. Do you know what ringworm is? It's a fungal infection of skin, very similar to like athlete's foot. And yet they can charge a high premium if somebody has ringworm. Or joint sprain, so you sprain your wrist, sprain your ankle, something like that, high premium. Migraine headaches, high premium. Mild depression, automatic decline or high premium. Obesity and sexually transmitted disease, either automatic decline or high premium. Now look, once you exclude these conditions, there's not much left. That kind of leaves individuals who are younger and healthier and are just going to pay their premiums and not have any medical expense through the year. Ooh, that's the ones that the insurance companies want. They don't want these individuals, so they exclude them from the system. And keep in mind, as they do that, these people often can't get health insurance because they don't qualify for public programs. And so they enter that pool of 46, 47 million individuals who don't have insurance. And that's a very dangerous pool to be in. Harvard did a study of people that are uninsured and underinsured and found an incidence of 45,000 premature deaths as a result of this, not getting medical attention in an appropriate manner because they don't have insurance. They did another study a few years back that studied the near elderly, people that age 50 to 64, they don't quite qualify for Medicare yet, and they studied the ones that do have insurance, the ones that don't have insurance. And of the ones that don't have insurance, they estimated that 100,000 individuals in that age category are likely to have premature death, especially if they are diabetic or have high blood pressure or heart disease, or if they are poor compared to their counterparts who do have insurance. So this is a deadly little game they're playing here. Why do they play that game? Because they don't want to pay out, because they want to maximize their profits. And many, many people suffer or die premature death as a result of that game, for them maximizing their profit. Is that good for our health system? Is that good for America? No. Why do they do it? To maximize their profit. Why? Because they're tied with Wall Street and they have to generate these massive profits. Now, of individuals that are awarded a health insurance policy through the same process, often these premiums are too high, astronomically too high. So the person looks at these plans and they try to get their premium down, and in order to do that they allow themselves to accept a policy that has a very high deductible, a very high copay. The result is that unless they have some catastrophic healthcare expense, then almost all their healthcare is out of their pocket. Ooh, the insurance companies love that because the patient is paying for all this on their own, and yet still have to pay the premium, this high premium, to the insurance company. So they're taking all the premiums and not having to pay out. And then even if the deductible is met, the insurance company has the audacity to charge a 10 or 20% copay on top of what they do eventually pay out because the deductible's met. Anyway, so patients try to get those deductibles down. How did they do that? They decline vision coverage, they decline dental coverage, they decline or decrease pharmacy coverage. The result is that numerous obstacles are thrown up between that patient and the physician and them getting proper health care. Patients often can't afford procedures or treatments because of these high deductibles. Even though they have insurance, they can't afford the proper care. And all too often people are not getting adequate or appropriate preventive care. Now, another item that we have to discuss is pre-certification. Pre-certification is another clause within your health insurance policy that states before any procedure, be it a diagnostic test or a surgery, has to be pre-approved by that insurance company before they will pay for it. And keep in mind, your doctor has already determined that you need that procedure, but they say, no, it has to be approved by us. And who's going to be doing it? A nurse that works for the insurance company. That's her job. And she is biased because she works for that insurance company, either biased to deny it or to delay it. And this happens all the time. I've spoken with doctors' offices that say that I won't even order such and such, even though that's what I want, because I don't have time to put up with the hassle from these insurance companies. Now, insurance companies should not have the ability to interfere with recommended treatments in order to maximize their profit, but that's exactly what they're doing. In the meantime, these insurance companies are taking these premiums to the bank. And let's take a look at just how successful they are.